Okay, in today's video, what I want to talk about is the importance of the diaphragm and pelvic floor to low back pain. And I think it's something that we should definitely be considering. Now, the problem is a lot of these tissues, they get overhyped or kind of over glorified, okay? The reality is they're a small part of the whole person, but I still think there's a very, very important to have an awareness of them. So when Shane goes to touch his toes, one of the first things that has to happen, if you come back up again, if you just start to touch all it there. So as Shane has the intention, we ask a patient, can you touch your toes or bend forward, touch your toes, whatever. The intention usually starts at the fingertips. So as Shane goes to touch his toes, we see there's a lot happening here before the patient even moves at the lumbar spine. So you'll see a lot of patients, and as they go to touch their toes, you're kind of disc-like type patients, SI type patients even. As you go to touch their toes, yeah, my pain comes on straight away. But my question is, why does that person have a pain experience in their lower back at that point of the movement? Okay, so the actual part of the movement of the toe touch can give us a lot of good information about where we should be looking to give back more movement so that the lumbar spine isn't maybe taking excessive load or decelerating a lot of load, okay? So as Shane touches his toes, one of the first things that has to happen is his ribcage has to depress. In order for his ribcage to depress and retract, his diaphragm has to lengthen, okay? So that's why the diaphragm, we need to have the diaphragm going through a full range of motion. We're not talking about trying to isolate the diaphragm. We're not trying to talk about doing loads of diaphragmatic breathing. All I'm interested in, and what I teach in my mentorship, is we want to restore the diaphragm's ability to go through a full range of motion, pretty much like every other tissue that we're working with, okay? So we're not going to over glorify it. We're just going to have an awareness that we want full range of motion through that. If we've got full range of motion through that, that's also going to mobilize the pelvic floor and vice versa, okay? And everything in between, the vital organs, etc. What you see a lot of patients do that have a significant, in my opinion, clinically significant inability to lengthen the diaphragm is they'll go into this extension-based kind of posture, okay? I can't remember who classified it as that. I think it might have been Wim Dan Karts or somebody like that. So if you just go again, Shane, but kind of go into that kind of extension-based. So in that position there, you can see Shane's going to get a lot of lower back extensors. And again, the research is pretty good with that. But what's not happening here, okay, is there's very, very little depression. In order to get length through the diaphragm, that also relies on ribcage depression. The obliques need to help depress that. The iliocostalis at the back, all those tissues need to lengthen. If we get iliocostalis to lengthen through ribcage depression, then that hopefully as well is going to take away a lot of that low back tone, okay? So the next time you've got a patient that has pain at the start of the movement in the low back, okay, or around that area, pain experience around there, let's start asking ourselves higher level questions. What's not doing its job that's maybe causing these areas of the body to do more work? So rather than getting that person on their back and APing, you know, and giving all these mobs and stuff like that to the low back area, have a look at the person and go, you know what, have you got a lot of stress on at the moment, okay? Because if that person's got a lot of stress on, they're probably gonna have a sensitized respiratory system anyways. Okay, if we've got a sensitized respiratory system, one thing that's going to happen there is the diaphragm's not going to have an opportunity to go through a full range of motion. If we're over breathing, which a lot of people in this day and age are, okay, again, I'm exaggerating it there, we're getting a lot of shortening, not a lot of lengthening. One of the best ways to lengthen the diaphragm, exhale. Okay, we've got ways to prolong that exhalation. There's all sorts of ways to do that, okay? That's for another time. I go into that extensively in my mentorship program, okay? But what I wanted to do today is just bring your awareness to the importance of that, okay? Don't misunderstand. I'm not glorifying the diaphragm and pelvic floor for 1 second, but I think they're two tissues that we need to make sure that we can get as much range of movement through those tissues as possible, okay? In terms of the stability component of the diaphragm, that's another story for another day. The crural fibers of the diaphragm, we're going to have to train them slightly different to the costal fibers, okay? If you want to look at the role of the diaphragm as it attaches to the lumbar spine, which I'll do in another video. But for today, if you have a patient that's getting pain on the toe touch at the start of the movement, then I'd love for you to just direct your attention to anything I can do above the rib cage, helping that rib cage to depress, to help the diaphragm to lengthen. And I think you'll be pleasantly surprised in what that does to the person's pain experience when they go to touch their toes. Okay, just an observation clinically from me, something that I get great results with. Let me know in the comments if you have any questions, and I'd be more than happy to answer them.